Cesarean section. Definition: Cesarean section is a surgical procedure in which the baby, placenta, and membranes are delivered through incision made in the mother's abdominal wall and uterus when vaginal delivery is not possible or is unsafe for the mother or fetus. Warning signs or indication for cesarean section. A cesarean section may be required when the following danger signs or conditions are present. Maternal indication: Cephalopelvic disproportion (CPD), obstructed labor, failure to progress in labor, severe pre-eclampsia or eclampsia, placenta previa, Abruptio placenta with fetal distress, previous classical caesarean section or uterine surgery, ruptured uterus or impending rupture, maternal infection, selected cases, fetal indication, fetal distress, cord prolapse, malpresentation, transverse lie, bro presentation, some breech presentations, multiple pregnancy with complications, macrosomia, large baby, pre-operative management of cesarean birth, assessment, take complete history and physical examination, check vital signs, blood pressure, pulse, respiration, temperature, assess fetal heart rate and fetal condition, review laboratory investigation, hemoglobin percentage, blood grouping, RH typing, urine test, preparation, explain the procedure and obtain informed consent, keep the patient NPO, nilpal oral, for 6 to 8 hours if possible, establish intravenous line and start prescribed fluids, arrange cross-matched blood if needed, shave and clean the operative site according to hospital protocol, insert Foley catheter to empty the bladder, administer prescribed medication and prophylactic antibiotics, remove jewelry, denture, nail polish and contact lenses, psychological support, reduce anxiety by providing emotional support, explain what will happen before, during, and after surgery, reassure the woman and family. Postoperative management of cesarean birth. Immediate postoperative care. Maintain airway and monitor breathing. Check vital signs regularly every 15 minutes initially, then every 30 minutes, then hourly as per protocol. Observe level of consciousness. Monitor oxygen saturation if available. Observation for complications. Assess vaginal bleeding and uterine contraction, observe abdominal dressing for bleeding or discharge, monitor urine output at least 30 milliliter per hour, watch for signs of shock, hemorrhage or infection. Pain management, assess pain level regularly, administer prescribed analgesics, encourage comfortable positioning, fluid and nutrition, continue IV fluids as prescribed, monitor intake and output, start oral fluids when bowel sound return, progress gradually to a normal diet. Prevention of complication. Encourage drip breathing and coughing exercise. Promote early ambulation to prevent deep vein thrombosis. Maintain proper perineal hygiene. Provide wound care and observe for infection. Maternal and newborn care. Encourage breastfeeding as early as possible. Promote mother-baby bonding. Teach proper breast care and newborn care. Health education before discharge, teach wound care at home, advise adequate rest and nutrition, explain danger sign, fever, excessive bleeding, foul smelling lochia, severe abdominal pain, redness or discharge from wound, schedule follow-up visits. Summary: Caesarean section is the surgical delivery of the baby through abdominal and uterine incision. Proper pre-operative preparation and post-operative nursing management are essential to prevent complication and ensure the well-being of both mother and baby.